Welcome to those who are returning. Welcome back. Anyone new, welcome if it's your first time. This is the monthly Snakebite Hub meeting. I see all the AI note takers are messaging in the chat right now. Hi, AI note takers. For those who are new, who may not know, we usually record these meetings and then post them on the hub. So if there's any issues with that, do let me know. And we can kind of deal with it as well. But as I shared via email, the agenda for today is actually quite simple. I was just going to update people on the data collection forms that we've been working on, and then talk about a potential special meeting in September. So for the data collection forms, for anyone who may have missed previous meetings or is new, just a bit of background. So this is something that we've been working on as a group for the last few months. We discussed this issue around standardized data collection for clinical snakebite research and decided to brainstorm sort of standard items that should be collected for snakebite patients that could help researchers understand not just the factors that are affecting snakebite, but also the treatment and management of these patients and the outcomes of these patients. So we brainstormed a very, very large form and then went through a bit of a voting process to see of all those different items that we thought were good to collect, which ones were the most important and most feasible to collect. And we came up with a sort of minimum data collection template. The minimum one was still quite long, which makes sense because a lot of these items are indeed quite important to collect. But now the time has come to actually pilot that minimum form and see if we can further refine it. So let me share. Let me share my screen. You're going to see yourselves for a second. So hopefully people can see that link there. I'll share this link. Let me just copy it so I can share it with you in the chat after this. But I've posted the forms on our hub now. You'll see it sort of in I'll explain kind of the format over here. We did talk a little bit last time about having a tool that sort of lets you pick and choose what fields you'd like to collect. That will be developed and sort of we're thinking maybe we can have that released alongside the final versions of the form after the pilot. But for now, what we've done is we've uploaded in both Word and Excel formats the full form and minimum form. So the minimum form was those fields that we had voted on. So on this page, you're able to download whichever version works best for you. So today we'll sort of discuss, hopefully more people are able to join and we can discuss who's able to pilot this form. So we'd be looking to pilot these forms both for prospective data collection. So if you have new snakebite patients coming in, you could use the Word format of the form. So Word format is better for prospective data collection, for example, because here if I actually let me share my whole screen so you can see everything. Share screen. There we go. So now you can actually see. So this is the Word version of the form. Which you can see might be better for prospective data collection because all of the fields are worded as questions, and you can quite literally print it out and then record the data if that's how it works in your institution. Whereas the Excel forms might be better for retrospective data collection. Oop, I see somebody's joining. The retrospective data might be better recorded in an Excel form. So you can see there's a data dictionary tab here, which explains what each field means. It also has all of the questions over here from the Word form, so you can match up which field is which, and then you can kind of record the data. So over here, each row would be a unique patient. But again, that's just a recommendation. We thought that it might be easier to prospectively collect with Word, but for you it might be easier with Excel. In any case, we've provided both versions of the full and minimum form. So what will be piloted will be this minimum form um, in both Word and Excel format. You'll notice there's just English templates now. It's because I'm sort of folks in this group helped me verify translations for French, Spanish, and Portuguese. So I'm just working on sort of adding those to the website now. So the next couple of days they will also be here so that we can pilot in different settings. But in terms of what it would mean to pilot, let me stop sharing the screen. What it would mean to pilot this would be to test it out within your institution for either prospective patients or retrospective patients or both, if you're able to do both. Um, we can sort of record how many you're able to do. Basically, it would be over the course of the next month. So in September, um, a few patients. If you can do more, great. But also, this is a very long form. So if you can only do a few patients, that is a-okay. So we're hoping to get a few. I know the gang in Zambia had also volunteered to pilot, but I'll just pose the question here. If there's anyone who is interested in piloting this in their institution, we can discuss that now. And if you have any questions, we can answer your questions. So I'll open the floor to any questions or discussions on this piece. Thanks. Oh, such Nuhu. Hi, Nuhu.
Hi,
Hello, how are
Ashna.
you?
I'm fine. Good afternoon, everybody. Sorry for joining late.
All good. Good afternoon.
Good
We
afternoon.
were just discussing, actually, since you are unmuted anyways, would you be interested in piloting this form at the Snakebite Treatment and Research Hospital? It could be good to see if it works on some of the retrospective data over there, if it's easy to map onto this.
Yeah, thank you so much. I think we will be glad to be part of the people that will do the pilot work on the tool. Even though I don't know whether Dr. Mani has joined us, but for us, I think it's a good thing. I would like actually to be part of the pilot. Yes.
Awesome. Thank you. Yeah, for anyone who's piloting, I'll follow up with an email with just some more instructions and then so we can get the details down for who is piloting what. Thank you.
Thank you so much.
Awesome. Of the others who are here, I'll try not to ask the note takers. Is there anyone else who is interested in piloting this in their setting? Perhaps Eric, if you're able to, or Dilipa, Smila.
Yeah, I'll discuss with one of my colleagues and see whether we can use it.
Awesome, sounds good. Sounds good, sounds good. Yeah, and it can be a fairly small and simple pilot too. It doesn't have to be a lot of patience. And since Smila is here, I'll also thank you once again for helping translate the French version. That was very helpful. But let me just share in the chat. Let me share where. There we go. That's where the forms currently live. As I said, it's the English ones are on there for now. in the next couple of days. The French, Spanish, and Portuguese ones should also be on there. And then that should help with piloting. And then once the plan is, I guess, in September, we can pilot. Next month's meeting, we can discuss any results from that pilot, and if we can further refine the data collection form. And we can also I'll work with Kwaku sort of behind the scenes to think about the actual tool for sort of so people can customize whatever they're collecting. I see someone new is also joining. But yeah, before we move on to the next topic, is there are any questions on the data collection forms, do let me know. And if not, I will follow up via email and look for anyone else who's able to pilot this. The more the merrier with pilots. So okie doke. I will take silence as everyone is clear. Awesome. In that case, perhaps we can move on to the next item of discussion, which is September 19th, as you may know, is the International Snakebite Awareness Day. And actually, credit to Nuhu and Dr. Amani. They had mentioned it would be kind of nice if we did something special for that day. So we were thinking of potentially holding a special meeting. So this would be in addition to our usual monthly meetings. The thing that would be different about this one would be it'd be a little bit more formal in that we would ask some hub members to present updates if they have updates, or if you want to talk about a particular snakebite research project you've done. It will be recorded and posted as we usually do. And then we'd also encourage people to share with their colleagues so that we have a broader audience for that particular meeting. I know a couple of people have expressed interest in presenting. I'll ask in this forum as well if there's anyone who is potentially interested in presenting on the 19th of September. And this can be a very short, depending on how many people volunteer, these can be quite short presentations about what your team is doing. It could be a really good way to get exposure, especially so on our mailing list we have quite a few people, so it'll be good to to provide exposure to your work as well. So if there's anyone who's interested, you may ask questions, volunteer now, or message me later.
Hello, Ashina.
Hello.
Yes. So yeah, I'm also interested to present. And what is the procedure? I mean, are we supposed to submit? I mean, an abstract, or I mean, if you could share some procedure, that would be helpful. Thank you.
Sure. Yes, of course. So in terms of procedure, it would be so the expectation would be to share sort of PowerPoint or some sort of slide deck with your presentation. I imagine the presentations would be about 10 to 15 minutes long per person, depending on how many people are interested in presenting. And then you could leave a few minutes for discussion also. Whether that discussion happens directly after your presentation or at the end, more like a panel, that's something we can decide as well. But then the expectation would be to share your slides. It doesn't have to be well in advance, even the day before, just so we have them on deck in case anything happens with the connection. And then, yeah, it'd be a 10 to 15 minute presentation on either a current research project that you're doing, introduction to your institution, facility. Of course, everything would be snakebite themed because of the nature of this hub and that awareness day. But it's, yeah, otherwise it's not super formal, if that answers your question.
Yes. Yeah. Thank you very much. Yeah.
Awesome. But thank you for volunteering to present.